is about your job. And this is for the people who might be considering, of any age, really. They could be a high school senior, they could be a first year college student, they could be somebody returning to school who's thinking about entering the mental health field. Just tell us a little bit about your job and any thoughts you have about why they should go into that field.
Yeah. So like I said, my official title is a child and family clinician. And I have a master's in social work. And my job entails providing mental health therapy to children of all ages, as well as parenting support for their caregivers. And sometimes that looks like being an advocate for them, or bridging the gap between mental health and their school life. It can be a wide range of different things, but the primary goal is to provide the mental health counseling. I'm also on the CDVRT team, which is a domestic violence response team through Sound. So working closely with families that are experiencing domestic violence, being able to connect them with advocates, housing resources, and things like that. And I guess, I don't know, advice that I would give, I think that you really should have a passion for wanting to help people out. If it's not something that you know for sure you're passionate about, then you might want to do a little bit more exploration on figuring that out before going into the field, because it can be very mentally taxing. And it entails a lot of introspection and growth. So I would just be very, I don't want to use the word cautious, but well-informed on what you might be getting into if you're considering a role in mental health.
Great. So last question is, what's most satisfying about the work that you do?
Ooh, that is a good question. I think whenever I get, two things that come to mind. Whenever I get positive feedback from any of my clients, oftentimes I feel like I'm preaching to the choir, I'm not making sense to them. They're not getting anything from our sessions, and things like that. And that, as a therapist, that can feel very isolating, and it can feel like I'm not making progress and I'm not being effective. But getting any type of feedback from my clients, whether it's this is great, I'm getting something from this, or actually you're not being very effective and this is not going to work. Either way, it is very satisfying to know that they're at least listening to me and getting something from it. The other thing that I've more recently found to be really rewarding is being able to track my growth. And the way that I'm able to do that now is talking to interns that we have. Sometimes they'll come to me and want to consult about a client, or just ask questions about sound or mental health in general. And when I'm able to provide some type of knowledge, it just shows me that I'm actually growing and learning in the field. And so that does feel really rewarding, to know that I'm making progress for myself as well.
All right. Excellent.